Trigger warning. Suicide is discussed in this podcast episode 187. Some people may find this triggering. If this causes any distress, please seek support and contact Lifeline Australia on 13 11 14. Suicide callback service on 1300 659 467 or the National Suicide Prevention Lifeline on 988 in the US. In a crisis, please contact your nearest emergency department at your hospital and seek immediate medical professional support and care. Hi everyone, it's yvetteleblowitz from SpiritGirl.com and welcome to Feel Good From Within. I'm super excited to be here with you today and with our very special guest, Dr. Gregory Scott Brown, who is a board certified psychiatrist, a mental health writer, and author of the SelfHealing Mind, an essential 5-step practice for overcoming anxiety and depression and revitalizing your life. He's also an affiliate faculty member at the University of Texas Dell Medical School. He believes we can work together to fight mental health stigma by having open and honest conversations about mental health. Dr. Brown is an advocate for evidence-based integrative care that includes incorporating exercise, mindfulness, meditation, and nutrition with standard of care treatments for mental illness. He's also an advocate for yoga and mindfulness meditation. He's even tried yoga nidra, which I discovered by listening to his brand new book on Audible. And I'm so grateful we're here today with Dr. Gregory Scott Brown because we're going to find out more about how we can practice self-care. Dr. Gregory Scott Brown, how are you today?
Yvette, thank you so much for having me. I'm just delighted to be here with you.
I'm so grateful. I've listened to your book on Audible whilst I was practicing self-care, doing my morning walk, and I loved it. And I'm so excited we're here with you today. And I want to welcome our global audience. I'm super grateful you're here with us today. Before we dive into your book, are you happy to tell us a little bit about yourself?
I'm a board certified psychiatrist. I actually live in Texas. I still actively treat patients. I have a clinical practice, but my non-clinical work has really allowed me to write for Men's Health magazine. I write a column for the magazine about mental health, and it's also allowed me to write this book. I'm someone, Yvette, who believes that psychiatrists have a role not only in our medical practices, but since mental health is such an important topic, I think that the more psychiatrists we have and mental health professionals sharing information about mental health with the public on social media, writing articles, writing books, and the more people we can reach, and the better off we'll all be.
I found it fascinating that you actually have discovered that medication alone isn't the one-stop shop, that whilst you have people coming into your office wanting a particular medication to make them feel better, you actually go through lifestyle, health, self-care. Can you share a little bit more about that and why?
Well, I think it's important to first off acknowledge the very important role that medications do play for people who are struggling with severe mental illness, with anxiety, depression, bipolar disorder, schizophrenia. As a psychiatrist, I prescribe medications in my clinic, and I definitely believe that they have a role. But at the same time, they're not the be-all, end-all. And I think it's important for people to realize that medications can only do so much. There was actually a big study that was published called the STAR-D that every psychiatrist has to learn about in our training, where researchers looked at thousands of patients and found that when given an antidepressant alone with no other interventions, people tend to get better about 30% of the time. There are 33% remission rates for depression. And so that leaves a big gap. What I found is that evidence-based self-care, things that I address in the book, like how to optimize sleep, nutrition, spirituality, breath work, moving our body in a way that makes sense and is in line with evidence, can actually help fill that gap.
And you've had reporters come to your office thinking that you're a yoga teacher and asking, is this your studio where you teach people yoga? Can you
Right.
tell us a little bit about how your own yoga journey unfolded and some of the benefits you find as a psychiatrist to your own mental health and well-being?
A big portion of my work is rooted in my personal story. So when I was in my early 20s, even though I'm a psychiatrist, I struggled with depression. I'm not immune to mental illness, just like everyone else isn't immune to it. And at the time, I had a difficult time really connecting with a therapist, connecting with a psychiatrist, but I did happen to discover some of these self-care strategies that I share about in the book. At the time, I had no idea that they were evidence-based, but one of those strategies was yoga. And I began to engage in a yoga practice. What I noticed is that after I practiced yoga on a very rudimentary level, I felt better. And so that was something that kept me coming back. Now, I'll tell you, Yvette, years later, when I completed a fellowship in integrative medicine, actually read some of the studies. When I went on to get my own yoga teacher training, I learned that when we breathe in a way that yoga practitioners breathe, Ujjayi pranayama, for example, or if we engage in 4-7-8 breathing, where you inhale for 4, hold for 7 seconds, exhale for 8 seconds, are actually things that are going on in the brain. So we're actually noticing an increase in GABA levels. So GABA is an inhibitory neurotransmitter that just slows everything down. If you were to actually hook up an EEG scan on the brain, you'd notice enhancement of alpha wave activity. So these are both physiologic markers of rest and relaxation. So yoga can be great for mild forms of anxiety, depression, mild ADHD as well.
Wow, that must be why I love yoga so much, because
Yes.
I'm actually
And
a yogi.
it's fun, right?
It's really good. I find it to be very therapeutic, and I feel like it works on my spiritual level, my movement level, my breath level, and I always feel good afterwards.
Right.
And I have found that to be pivotal to my mental health and well-being and coping with stress.
And I think it's important that we remind ourselves that this stuff, it seems like common sense. And I would say that's one of the biggest criticisms that I get about this book. And it's a criticism that I welcome, because I'll tell you, as a psychiatrist, the stuff that I'm talking about in my book are things that a lot of my patients are not trying, or they've tried maybe once. They've been to a yoga class, they didn't have a good experience, and so they never went back. Or maybe they tried meditation, and like me, their first meditation experience wasn't easy, it wasn't intuitive, right? And so maybe they didn't try it again. I would just encourage people not only to read the book and learn about how to approach self-care in a way that is consistent with evidence, but to also keep at it, right? If you notice that from your first yoga experience, it wasn't a positive one, keep doing it, keep trying, because it does get easier in time. And like you and I have experienced, it can help you feel better.
And I had to try so many times. I tried hot yoga and I got severely dehydrated, and that didn't work for me. Then I tried vinyasa yoga, hatha yoga, restorative yoga. I tried kundalini yoga. I tried so many different yoga classes and teachers. And then I think it's taken about 10 years to figure out what kind of yoga I like, what teacher's voice I like, what setting I like. I mean, it's been a journey. And also, you said breath is medicine. You talked about the relaxing breath. There was something so interesting in your story. You were in hospital, you had an elderly patient needing to be calmed down. Someone wanted you to immediately prescribe a particular drug, and you were like, hang on a minute, I'm just going to talk to the patient and speak to her first. Can you share a little bit more about that story that you shared in your book?
Sure. I'll tell you, in modern medicine, that self-care piece of breath work is often a step that's skipped over. Right? So we'll go straight to a conversation about medications. Now, again, medications can be great, but the story you're referring to is I was covering an inpatient unit one weekend and was up in the physician's lounge. I got a call from one of the nurses who said an elderly patient just arrived on the floor. She's very anxious. Can I get a prescription for Ativan, which is a benzodiazepine medication, can be very effective for anxiety. But these medications can also be habit forming. If you take them consistently, they can increase the risk for falls and can have other side effects, especially if you're giving them to elderly patients. And again, I hadn't even gone to the floor and met with this patient yet. And I'd say that our system kind of trains us to say, okay, let's give the patient medication, patient suffer. But that particular day, I went down to the floor. I was just starting to learn about some of the evidence behind breath work. I sat at the bedside with this woman who was extremely anxious, and we did a couple of rounds of 4-7-8 breathing together, which is when you inhale for 4 seconds, hold for 7 seconds, and exhale for 8 seconds. And I'll tell you, the evidence behind 4-7-8 breathing has less to do with the numbers and more to do with the fact that when we exhale for longer than we inhale, we're activating something called the parasympathetic nervous system. What the parasympathetic nervous system does, again, is it slows everything down. It puts our body into a quote unquote rest and digest state. And so it's all science. It works. And that was a case where the patient, after a couple of rounds of 4-7-8, didn't even need a medication. She felt much more relaxed.
Wow. And you also do alternate nostril breathing even before you're going to do a presentation. Can you share a little bit more about that?
So that's one of the other forms of breath work that I describe in the book. And with alternate nostril breath, if there's anyone who's listening who has tried a yoga class, you might be familiar with both alternate nostril breathing and Ujjayi pranayama, which is another technique I talk about. But essentially what you're doing is you are covering one nostril, say your right nostril with your thumb, inhale with your left nostril, take your ring finger of the same hand, cover your left nostril, and exhale through your right nostril. And then you just alternate, inhaling and exhaling. Now, what that can do is, and I'm imagining everyone who's listening doing alternate nostril breath like we are. But what that can do, similar to Ujjayi pranayama, is just create some gentle resistance. Okay. Now, the first time I tried alternate nostril breathing, it was uncomfortable. I was in Austin. I have seasonal allergies. I felt like I was suffocating. I couldn't breathe, right? But again, I mean, it gets easier. And so I would just encourage people to keep at it because it's a great way to calm the mind and reduce anxiety.
And I liked how you shared box breathing.
Mm-hmm.
That I thought, even if someone's like, ooh, yoga's too woo-woo, or mindfulness meditation, what? I'm not spiritual. I liked the idea of box breathing. Can you share that so anyone listening in, you might want to pull over in the car right about now on the highway, or do this later this evening or tomorrow?
Definitely don't do it when you're driving, right? So with box breathing is really a form of what I call coherent breathing. And that's really just bringing your awareness to your breath. We take between 20 and 30,000 breaths every single day. And most of us, unless we're ill, right, don't even pay attention to the fact that we're breathing. So with box breathing, you're really just inhaling, count to 4, hold, count to 4, exhale, count to 4. And it can be a great way to tap into your breath. If you have an Apple iWatch, sometimes they'll coach you through specific types of their version of box breathing to really help you key in to your breath. So it's a great place to get started.
And what are the 5 pillars to self-care?
So the 5 pillars of self-care that are outlined in the book are sleep, spirituality, nutrition, breath work, and movement. And I'll just add here that a lot of people have asked me, why didn't you include therapy as a self-care pillar? Now, therapy is great, and I encourage anyone who can invest in therapy to do it, but it's also important to realize that therapy is very expensive and not everyone can access it. So I wanted to focus on self-care pillars that all of us could access regardless of our walk in life.
And when it comes to sleep, you talked about us setting up a bedtime ritual. Can you just give us a couple of tips on that and why you feel sleep is so important to the brain and our mental health and well-being?
So a couple of reasons. So when we sleep, there's something called the glymphatic system that is activated. And essentially this is a process that is basically ridding the brain of toxins, of waste products, right? So that we can be refreshed. Scientists have discovered that when people are depressed or they're anxious, they don't get as much N3, deep, slow wave sleep. This is restorative sleep that allows us to feel alert and refreshed when we get going the next day. So sleep is very important. There are a lot of things that can wreak havoc on not necessarily the quantity of sleep we get, but the quality of sleep. Alcohol is one of those things, and I'm not talking about a glass or two of wine every now and there. What I mean is habitual alcohol use, overdoing it, can wreak havoc on sleep architecture. When we're talking about why sleep is so important, it's important to realize that it has a bidirectional relationship on mental health. So if we're not getting quality sleep, then it can affect our mental health. And if we're struggling with depression, anxiety, burnout, etc., then that can also affect the quality of sleep that we get.
And you mentioned we should have no TV in the room. The bedroom is for sleep and sex.
That's it. Nothing else.
And literally that we should try 1 hour before switching off technology, things like that, trying to get into a sleep state.
So when we're talking about a sleep ritual, we really want to think about the fact that many of us, when we get up and get going for the day, if you're like me, maybe you'll have a cup of coffee, some breakfast, read the news. Some of us will get our kids ready to send them off to school. And it takes us some time to get up and get going. It's not like we just get out of bed and boom, we're ready to start our day. But oftentimes at the end of the day, we don't take as much time as we need to wind down. And this is specifically pertinent when it comes to devices. With the global pandemic, with COVID, a lot of us were spending more time on our smartphones and our computers all day for work, whereas we're watching TV at the end of the day. We know that blue and green wavelengths of light that are emitted from our devices can actually block the release or inhibit the release of melatonin, which is really important in telling our brain that it's time for us to go to sleep. So if we can get into a sleep ritual, which could mean an hour before bed, trying to limit the amount of screen time that we engage in, maybe having a hot cup of tea or warm bath, something that we do every night to help us wind down, can tell our brain that it's time for us to go to sleep and in turn improve our sleep quality.
Wow, you dedicated quite a lot to this. Movement. Sometimes it's hard to move because our mind might say, I can't be bothered. But moving always makes us feel better after we do it. Why is that?
Well, here's the thing, and I want to make this point here. I mean, if someone's listening and they're struggling with mild depression, for example, and saying, was that doctor really telling me to move? I mean, this is evidence-based. There was a big meta-analysis in the American Journal of Psychiatry, recent study that actually found that people who moved their bodies more had reduced risk for developing depression, regardless of age or geographic region. And some of the science behind why this could potentially work is that when we move our body, there's a protein called BDNF, brain-derived neurotrophic factor, that is enhanced in the brain. And what that protein does is it kind of acts like fertilizer in the brain. It allows our neurons, our brain cells, to communicate with each other more efficiently so that we can reach optimal levels of neurotransmitters like serotonin and dopamine and norepinephrine, the same neurotransmitters that medications, antidepressants and anti-anxiety medications work on. So movement is definitely medicine. And the other important thing to keep in mind is that I'm not asking anyone to join a fancy gym or to run a marathon. If you're taking your medications or prescribed medications, keep taking them. If you're going to therapy, keep going to therapy. But incorporating just 10 minutes of movement a day, whether it's walking to the mailbox, stretching in your chair, dancing around the house with your kids, I mean, that is part of your treatment too, and it can be very effective.
I love that because I started with 5 minutes movement. I was 25 plus kilos overweight. I was the unmotivated person sitting on the couch, feeling depressed, feeling sorry for myself. And once I started moving, just get those shoes on and I moved, I felt so much better. And in time, I think it's a nice feeling when you progress in anything, whether that's exercise or anything in life. So movement I can vouch for.
Yes.
Movement is a go-to. So I love that in your book. You are always helping a lot of people when it comes to their own mental health. What are your self-care rituals and what do they look like?
I mean, movement is huge for me. We just ended on that. So I'll pick up right there. I mean, I am constantly moving my body, whether it's going for walks outside. Again, being outside in nature is very important for me as well. I mean, we're learning more as a scientific community about the relationship between vitamin D and mental illness. Vitamin D is actually converted to its active form when sunlight hits the skin. So being outside and moving in nature kind of has a double effect, moving your body and then also increasing active levels of vitamin D. Paying attention to what I eat. And again, no one is asking you to be perfect. You don't have to eat clean every single day all the time. And that's unrealistic. But being cognizant of making sure that we're getting enough nutrient dense foods. So dark leafy greens, which are also the precursors for the neurotransmitters that are important for mental health. Making sure that I'm getting enough omega-3 fatty acids in that's found in oily fish like salmon, mackerel, tuna. I mean, these are so important for mental health, and that's part of my own mental health ritual.
That's so incredible. And how often do you practice yoga?
I mean, I'll tell you that COVID has definitely changed my yoga practice, because pre-COVID, I was going into a yoga studio 5-6 days a week. I mean, every day after work, I mean, it was something that I would do. And after COVID, the world has looked totally different. That studio that I used to go to is not even open anymore. So I started doing yoga online. I think that's one of the great things about the internet, is that we can connect with an online community. But I'm still going into studio whenever I can, but yoga is definitely a part of my mental health regimen.
And what about your meditation?
For me, it's sitting or laying down in stillness, focusing on my breath. I love to use apps. I mean, I think it's really great. I use Insight Timer, I use Calm. I have an Aura Ring, which has some great meditations on there as well. I think the thing about meditation that intimidates a lot of people that I talk to is that they think that you have to join a fancy meditation club. They've never tried it before, and so they think they're not going to be good at it. They think people are going to look at them and say, oh, look at that weirdo. What is he doing? Or she, what are they doing? But I think the important thing to realize about meditation is that there's no right or wrong way to do it. And you can start with a 5-minute meditation practice. I'll tell you, most days when I meditate, I like to meditate in the morning to start my day. That tends to be the time when I feel most anxious. I mean, everyone experiences anxiety at a different time, but if I'm able to hijack the anxiety that I would feel in the morning with 5 or 10 minutes of meditation outside of my patio, then I'm able to get ahead of that. And I notice that my day is much better.
And in your book, you shared there was research where if you meditate consistently, that it can improve your overall mental health and well-being. So there's some
Right.
really great research behind it, isn't there? Why we should do it.
Particularly when it comes to a specific type of meditation that we kind of talked about earlier called yoga nidra. Well, most of that research looked at yoga nidra, which is type of meditative yoga that gained a lot of attention by a psychologist by the name of Richard Miller, who did a lot of research into yoga nidra, called it I rest yoga, and found that 15 minutes of yoga nidra over a period of weeks can actually improve anxiety, can improve sleep quality. And you wouldn't necessarily have to do yoga nidra meditation right before you go to sleep. So you can do it anytime during the day, but it can really change the way that the mind and the body work.
Wow. Your book is out now, The SelfHealing Mind. Can you tell us, why did you choose that title and what is the meaning behind the book title?
That is a beautiful question. I mean, the mind is such a powerful tool. And I strongly believe that the mind has the ability to heal. And we have an innate healing ability that if we only utilize or acknowledge that self-care is evidence-based medicine, things that we all have access to. Everyone listening to this, if you're alive, you're breathing, right? You can move your body, right? I mean, we sleep every night. I mean, these simple techniques, if we are doing it, again, in a way that's not necessarily intuitive, but evidence-based approaches that I outline in the book, can actually allow the mind, in many cases, to heal itself. Now, sometimes the mind does need the help of a medication or the assistance from a good therapist, and there's nothing wrong with that, and strongly support that. But at the same time, we shouldn't take these self-care strategies that are so powerful for granted.
I love the book title, and obviously I've listened to it. Highly recommend it for everyone, The SelfHealing Mind. I loved how the focus was on self-care and how we can use that daily, which doesn't have to cost the earth, and we
Right.
can introduce it into our life to prevent mental illness, to get us more into a mental health state, but overall use that really to take care of our health and well-being. And even if people are recovering, and it might be the first time they're taking on self-care, because sometimes when we don't practice self-care, what I've discovered, that's when you do burn out and you can get unwell and ill by practicing no self-care.
And that can be when it's the hardest to actually come back to self-care.
Yes.
And so, for anyone listening to this, that's really when we need to lock into self-care. I'll tell you, I'm someone who struggled with depression in the past, but it's not like even these years later that there's still some times when I'm like, I feel that cloud coming over my head again. And I think that the fact that I do know that self-care is evidence-based, I'll tell myself, okay, this is really the time when you need to move your body. You need to really focus on your breath. You need to focus on the quality of sleep. Are you doing things that might be affecting your sleep quality? How might we work to correct those things? And I notice that when I do that, it can have a dramatic effect on the way that I feel.
I totally vouch for that. As someone who practiced zero self-care and burnt out, to now it's a daily ritual. It's my thriving state. And I'm like, I've got to get as many people into practicing self-care as I can. And when I found your book, I was like, this is amazing, because you did all of the research, all of the science, and everything in there that can help us. But on another note, the amount of people sadly dying each year through suicide was unimaginable. When I listened to that there's one suicide every 40 seconds, I thought, have I heard that right? There was a chapter where you said give up on death. And you also shared one of the suicide prevention activists, Kevin Hines' story. But can you just tell us a bit more about that? It's a confronting conversation to have. But something I took away from that was going, we got to take it off the table. It can no longer be an option.
So the reason I included that chapter is really to give people hope. You're right. Suicide is one of those tragedies that unfortunately occurs too often. And, one suicide is too many suicides. Here in the United States, I can tell you there are over 130 suicides on average every single day. It's definitely a problem. And I'll tell you, Kevin Hines is just a remarkable guy I've gotten to know. I've interviewed him a couple of times. I included his story in this book. Now, when Kevin was, I believe, 19 years old, he was living in San Francisco. He was struggling with bipolar disorder. And he woke up one morning, took a bus to the Golden Gate Bridge, and decided that he was going to end his life. And that day, he jumped off the bridge expecting to die, and he miraculously survived. And I'll tell you that Kevin has gone on to really become a suicide prevention activist. He shared his story in the United States and around the world. And one of the things that he shared with me that I think is one of the main takeaways from his story is the importance of buying ourselves time in those critical moments. And so I tend to think of it kind of like a wick or a fuse on a bomb. The longer the wick or the longer the fuse is, the higher the chances are that it'll burn out. It'll fizzle out before any explosion takes place. One way that you can buy time is by reaching out to a friend, calling the suicide hotline, engaging in breath work, journaling. And I think the most important thing to do in those critical moments is to talk to someone, anyone, because the vast majority of people who attempt suicide, I can tell you this as a psychiatrist who works with patients every week, the vast majority of people who attempt suicide regret it. It's important to keep that in mind.
And I think when you shared Kevin Hines' story, that was one of the things he discovered as a survivor, that he regretted it. Other thing I found profoundly interesting, people couldn't see that he was distressed, and he was waiting for people to notice him or acknowledge his pain. And it made me realize, in this world we're living in, if we've got our head down the phone and someone might be crying beside us on the bus and we don't take the time to acknowledge, are you okay? How are you? It's a difference between saving a life or giving that person hope or changing the course. That was a profound finding that you shared in your book.
That is absolutely right. And I think that's why podcasts like this one and conversations like this are so critically important. I mean, not everyone who's suffering is going to get professional help. Not everyone who's suffering is going to be able to have a conversation with the first or second or third person they reach out to. But I think if we all realize our role in helping keep the people around us safe, then I actually believe that we can start to see a reduction in some of those suicide statistics so that we're not losing as many people to suicide.
I got a nice story about that. I went and paid for some fuel, and I noticed this older gentleman who was serving me was so distressed. I could just tell, man, he's in a bad place. You could just tell there was this look about him, distraught, distressed, white. I don't know how I could pick up on it, but I asked him, are you okay? And that leads into the Are You Okay Day, which is in September each year. But I asked that question, are you okay? How are you today? And then he revealed to me that he was losing his rental property. He couldn't afford rent. His wage didn't cover his rent. And that he was facing, after 10 years living in this place, living in his vehicle. And he didn't know what he was going to do. So I said, why don't you just put a little ad here and ask if anyone's got a place? Just tell people. Let them know what's going on. You see so many people coming in. So anyway, he did that. And I think I saw him 3 months later and he's super happy. He went to serve me and he said, life is good. I found something. And I gave him that hope. You'll find something. Ask people. Put it out there. If people don't know, how can we help you? So it was a really nice story in the power of conversation and just checking in when someone looks a bit distraught. And I loved how you reiterated that in the book. I've lost my cousin to suicide at 18 years of age. She was very young. And I think what I've discovered after listening to other people's stories, and you might be able to shed more light on this, is some people think if they have a self-harm thought or the thought is trying to hatch out how it's going to shut the brain down, that if they just don't think about it, it'll go away. Now, sadly, we know that it's a sign that the brain isn't functioning optimally well. Can you share more light on this? Because people just think having self-harm thoughts, I just don't think about it, I'm not going to tell anyone, and it's going to get better and I'm going to be okay and things will go away. But sadly, as someone who's lost a family member to suicide, I can tell you if they're having self-harm thoughts, it doesn't just go away. There can be some very deadly outcomes from it.
That's right. And I'll tell you, I actually wrote an article about that topic for Men's Health magazine. I think it was last year, because I'll tell you, a lot of times when people are experiencing self-harm thoughts or suicidal thoughts, sometimes they don't even want to share that with their psychiatrist because they're afraid that I'm going to send them to a hospital. They're afraid to share that with their family or their friends because they think that people are going to think that they're crazy. Now, it's important to realize that some people may not react or respond in a kind way. I mean, that is the reality of the world that we live in. But I think what I would advocate, and what Kevin, I don't want to speak for him, but what I think he would also advocate is that we just keep talking to people, because most people do not share that view. I mean, most people you talk to, if you reach out and you say, hey, I'm having a hard time, I'm struggling, this is what I'm thinking about. Most people don't wish harm upon the people around them. We want to see people thrive. We want to see them do well. And I'll also say that as a psychiatrist, I don't hospitalize all of my patients who tell me about their thoughts. In fact, most of them don't need to go to the hospital. It involves coming up with a good plan. Whether that means, okay, when you start thinking this, are you going to pick up the phone and call your buddy? Your buddy going to come over and spend some time with you, or reach out to your wife or your husband, or send me a note. But the most important thing we do is that we don't sit in silence with the thoughts that we're experiencing, especially suicidal thoughts, because most of the time they don't go away when we do that. They just get louder and louder and louder.
And I think through my family experience, we discovered my cousin reached out to a doctor, a general practitioner, who did prescribe an antidepressant, and then she went on it and stopped. But what we've discovered is, and in Australia, we're very fortunate, we get subsidy to go through Medicare to see a trained psychiatrist. And what we've discovered is, if you can, please see a specialist in psychiatry medication, because she was in a very small country town. The GP, as much as bless the GPs, however, if you're not getting better, go and see the psychiatrist, because they're so educated and qualified in the medication. Yeah. And I think that could have made a massive difference. Yeah. And that's something we've just discovered as a family over the period of sitting back and thinking, how did we go wrong? What did we do?
Right.
And another message I would suggest is, don't go off the medication instantly.
Sure. Yeah.
What do you think about that?
I mean, you sound like a psychiatrist now, because that is exactly right. Yeah.
Your books help me. Your books help.
I know you don't need me anymore. But one of the biggest mistakes people make is that when they're on medications, especially after they've been on medications for a period of time, they either find themselves feeling better, or they find that they're not feeling better, and then they just abruptly stop. And that is the worst thing that you can do. And there's a reason why we train so long to learn how to prescribe and manage these medications. So, definitely reach out to a mental health professional before making that decision.
And we're going to finish on a positive note. What is your hope for your newfound book readers or Audible audio listeners?
That's an easy one. I want as many people to read or to listen to this book as possible. I hope it's not just people who look at the title and say, oh, I'm depressed, or I'm anxious, or I know someone who's depressed, or I know someone who's anxious. And if I'm not, then the book doesn't really pertain to me. This book is for everyone. I'm hoping that this book will change the way we think and talk about mental health, regardless of our walk in life.
I love your book. It's one of my favorites, and it's going to be part of our Spirit Girl book club. Yes. So hashtag Dr. Gregory Scott Brown, hashtag the SelfHealing Mind, just hashtag Spirit Girl book club, and let's get this book out, because I truly believe it's all inclusive. And I really loved learning about your story, Dr. Gregory Scott Brown. You gave up music to become a psychiatrist.
That's a long road. Maybe that's another podcast.
We're going to keep that for another podcast show.
But let me tell you, I am so glad that I am a psychiatrist. It is the privilege of a lifetime, not only to be seeing patients, but to be able to advocate for mental health, because it is such an important topic. I'm glad to be able to do it.
I'm super grateful. Thank you.
Thank you for having me. See ya. Thanks so much.
Thanks for listening into this week's Spirit Girl podcast episode. If you'd like to stay in contact with Dr. Gregory Scott Brown, you can at gregoryscottbrown.com, or follow him on Instagram at GregorySBrownMD. I hope you found this conversation of interest and benefit to you. In support, I would love for you to subscribe to Feel Good From Within with Yvette Leblowitz and to leave a 5-star rating and a review of what you think too. Share this show with your family, friends, and community, and subscribe to my mailing list at spiritgirl.com, yvetteleblowitz.com, and feelgoodfromwithin.com. Follow Spirit Girl, Feel Good From Within, Yvette Leblowitz on any social media app. And together, let's feel good from within.